Do you have lower back pain that hurts when you bend over? If so, you might be considered what's called flexion sensitive. So in the very acute stages of your injury, you want to try to limit how much forward bending you're doing. I like to compare this to a deep paper cut in your knuckle. So every time you bend that knuckle, it stings a little bit. Just like when you bend over, you have that pain. So you're not really injuring your back any further, but it's just pretty sensitive when you do that motion. So it just takes a little bit of extra time for that paper cut to heal because it's constantly bending. So the same thing for that lower back. If we can limit how much bending we're doing in the beginning stages, it's just going to heal a little bit quicker. Some exercises that might help your back are extension-based exercises, which I will show you here next. The first exercise is going to be prone extensions. So you can start by lying on your belly, on your forearms. So you're just going to push up, keeping those hips down on the floor, and you're just going to the point where you feel maybe a little pressure in the lower back, but definitely don't push beyond any onset of pain. If this is really easy, you can also progress this to a prone press up by pushing up onto those hands. Again, trying to keep those hips down, hold here about 10 seconds, and then come back down. You do not want to keep pushing if your pain is getting worse or if you have pain that is going down your leg. We want to see the pain gradually getting less and less each time. The next exercise is a sciatic nerve glide. You can do this on your back or you can do this in sitting. So on your back it's going to look like this. One leg is going to be out straight. The painful side, you're going to bend up, hold right behind your knee, and you're going to extend your knee until you feel a little tension. Then you're going to point and flex your foot about 5 times. Then let that knee bend, and again, straighten the knee until you feel some tension in the back of your leg. Point, flex, 5 times. And you'll go through this about 10 reps once a day. A seated sciatic nerve glide would look something like this. So from your desk chair or a bench, you're going to sit up nice and tall. The leg that is painful, you're going to extend at the knee, and as you kick your leg out straight, you're going to look up and flex your foot. Then you're going to look down as your knee starts to bend back down, and then you point your foot under. So there is an imaginary string from your nose to your big toe. So as your nose looks up, your big toe comes up with it. As you come back down, it pulls your chin and nose down. So you'll do 10 repetitions of those a few times a day. And that's going to bring blood flow to that nerve. It's going to mobilize that nerve back and forth, making sure it's not restricted at any point along the path from its lower back, from your lower back to your foot. If you sit a lot at work, I suggest you get up every hour at least and do lumbar extensions, walk around, change positions. So hands on hips, drop those hips forward. You're trying to create some extension at that lower back. So do 5 to 10 of these every hour, making sure you're getting up from your chair.